Good morning, friends. Myself, Dr. Shrinidhi K, Acharya, National Institute of Ayurveda, Jaipur. Friends, today we will discuss about management of childhood asthma with special reference to Shwasa in children, okay, and Ayurvedic understanding. So we will see how to manage asthmatic children in Ayurvedic way by using Ayurvedic principles. See, Shwasa is a condition where there is difficulty in breathing. However, the disease is being classified in the classics depending upon the severity of the condition. Mahashwasa implies all such clinical stages where Shwasa is present at the end stage of the disease and it is incurable. Symptoms are suggestive of end stage of the life and patient cannot be saved. That is quite clear. And meantime, Urdhva denotes a less severe condition compared to Mahashwasa and still it is incurable. Similarly, Chinna Shwasa is also quite incurable. And explanations in Chinna Shwasa as well as Urdhva Shwasa are suggestive of certain restrictive and obstructive disorders of the lung. One more is Tamaka Shwasa, which is considered as yapya or curable with the difficulty, has been explained. And at the last, the Kshuddra Shwasa, which is less severe form, and Sukha Sadhya has been explained. Kshuddra Shwasa may be the Shwasa which is occurring because of some non-pulmonary or extra-pulmonary causes, other than pulmonary causes. So like this, Shwasa has been classified in the classics. Now, with a special reference to children, when we consider the Shwasa, the first step that we will see is the treatment of Shwasa, that is hyperreactive airway disease. Now, this hyperreactive airway disease is an interface between Kasa and Shwasa because Vagbhata says Kasa Vruddhi leads to Shwasa. Okay, so or they are interrelated. So, this is an in-between stage between Kasa and Shwasa. So, Vagbhata says Kasa Rodha Bhave Shwasa or Kasa Bhave Shwasa. So, here child of recurrent respiratory tract infection presents with the difficulty in breathing, so with the wheeze-like sounds and indrawing of the chest wall on respiration, and sometimes they are using the inhalers. So, recurrent infections of the respiratory tract leads to atrophy and desquamation of the epithelial tissue and mucosa, and as a result there is altered quality of the secretions, and as a result there is change in the configuration of the cells, and that leads to hyper-irritation. This hyper-irritation leads to increased respiratory rate. Okay, this is a pathology. Basically, this is due to repeated Kasa. Kasa Rogha Bhave Shwasa. So, here there is Shwasa occurring because of repeated Kasa attacks. Okay, so such conditions has been termed as hyperreactive airway disease in the contemporary medical science. Same is explained here as an interface between Kasa and Shwasa. So, basically this is due to because of repeated Kasa, later it leads to bronchospasm leading to a asthma-like presentation because of a bronchospasm. Now, treatment of hyperreactive airway disorders and interface between Kasa and Shwasa. So, first line of treatment is we have to restore the epithelium, respiratory epithelium, for which we have to bring back the reversal of the epithelium. Epithelium has to be regenerated, and for which we have to give certain drugs which are rasayana in nature, so that the damaged epithelium will be corrected and that irritation will be minimized. Spasm of the bronchial smooth muscle has to be reduced because spasm of the bronchial smooth muscle always leads to emergency condition. So, the spasm should be reduced by employing the Vatahara treatment, that is anti-spasmodic treatment of different types that we will discuss later. One more line of treatment in this condition is Santarpana Chikitsa. This helps for the regeneration of the atrophied or destroyed mucosa, vitamin A supplementation, zinc supplementation, and some other micromineral supplementation which helps for the restoring the respiratory epithelium so that this problem will be minimized. Rasayana treatment should be given to restore the dhatus. Immunological treatment should be given to restore the ojas, and Snehana Dhumapana is to maintain the antiseptic environment inside the respiratory epithelium. Madhura and Tikta Rasa Prayoga should be done to decrease the irritation and to have a Brahmana and Jivaniya effect. And if the sputum collection is more, then we have to go for anti-tussive treatment. So, this is interface between Kasa and Shwasa meantime it is mentioned as hypersensitive airway disease, which is commonly the diagnosis in contemporary medical science. So that is the interface between Kapha and Shwasa, and it has to be managed as I explained so far. Now let us see the management of dyspnea in children. When the disease reaches the lung parenchyma, the respiratory rate increases and labored breathing will be there. See, in the upper respiratory tract infection, there is only the kshavatu and asana. In the lower respiratory infection, there will be kasa of different types. And in the when the disease reaches the lung parenchyma, there will be respiratory problem. Okay, either increased respiratory rate, or there may be dyspnea-like presentation, or labored breathing will be seen. So, in the classics, it is told that this particular Shwasa can occur because of three things. One is Pranamahashrotas, Udakavashrotas, and Annamahashrotas get involved. There are certain factors which cause asthma in children where the Pranamahashrotas is the cause. For example, bronchospasm. The bronchospasm is occurring at the different level of the bronchial tubules. So, because of release of histamine, there is sudden contraction of the bronchial smooth muscle, so which blocks the airflow, and there will be a labored breathing or respiratory distress. So, there will be a mast cell stimulation causing all these problems. So, this is actually a cause related to Pranamahashrotas. Similarly, decreased diffusion. This respiratory problem in asthma may be also because of decreased diffusion. Okay, this decreased diffusion of the oxygen into the pulmonary vessels, that may be also because of a fluid pathology, fibrotic-like condition, calcification-like condition, collapse, etc. Okay, this is Pranamahashrotas. Involvement of the Pranamahashrotas is obvious. Similarly, there is involvement of Udakavashrotas. Okay, so many times asthma is because of pulmonary edema. It may be because of right heart failure or some other causes, or passive reverse pathology by the liver. Okay, a passive obstruction to the liver also. So they may lead to different fluid pathologies leading to pulmonary edema, and that edema fluid itself is the cause of obstruction. Okay, similarly, core pulmonary like conditions is also one of the cause of respiratory problems, because it is very clearly told, 𝘠𝑦𝑎 dhātūnāṃ ca upashoshanam. A Pranamahashrota disorder may be get converted into disease of the cardiovascular system leading to car pulmonale, and this car pulmonale is explained as a basic cause of Shwasa. So here involvement of Udakavashrotas is quite obvious by these fluid pathologies. Similarly, Annamahashrotas is also get involved. Annamahashrotas involvement may be seen because of certain compression pathologies. Okay, there are some certain compression pathologies may lead to the decrease in the total area available for the perfusion or area available for the ventilation, obese patients, or some rib problems, skeletal problems, okay, or metabolic problems, and there will be increased respiratory rate, or reflux esophagitis like conditions. So like this, even Annamahashrotas is also involved. So in total, Prana Udaka Annamanam Shrotansi Dushta, what he is told in the classics, that is justified here by the explanation of these three causes. Now clinically, when we see what clinically asthma may be. Clinically asthma may be as a bronchospasm. Asthma may be because, clinically we will see, so bronchospasm may be because of various causes. So that is one of the causes why asthma. Okay, that is difficulty in breathing occur because of various causes, various levels of severity of bronchospasm can occur. Number two, fluid pathology is one more cause for decreased perfusion, decreased oxygenation, and decreased diffusion, and that may lead to asthma. Similarly, hyperreactivity of the bronchial tree, which cause sudden contraction of the bronchial smooth muscle and mast cell stimulation, etc. So that is one of the basic cause. Inflammation of the airway, that is one more important cause which may cause, because of inflammation there is edema formation in the epithelial lining or the mucous lining, and as a result the area available for the passage of the air is very less, and that may lead to the problem. Similarly, decreased compliance of the lung. Decreased compliance of the lung is also one of the major cause that may also lead to the asthma. Okay, neuromuscular causes, accessory muscles of the respiration are not in a position to work. Okay, strenuous exercise, the contraction is not possible, their tone is less or power is less. That leads to neuromuscular problems, which leads to decreased ventilation and resulting in asthma. Similarly, extrapulmonary causes. There may be some extrapulmonary causes. There may be some causes from the which indirectly influence the ventilation. Okay, there may be right heart failure. So these are some of the commonest causes in general practice we see in children, where there will be development of asthma-like condition. Now broadly, we divide these two conditions in two ways. Asthma can occur because of different causes. We broadly divided him in two ways. One is causes of asthma because of obstruction. Another one is causes of asthma because of restriction. What is the difference? Obstruction means there is obstruction for the flow of the air inside, and restriction means the airflow inside is allowed but it is not going out. Expiration is difficult. The same has been explained by Charaka in the context of 𝑢rধ্ୱ-Shwasa. He very clearly says that 𝑢rধ্ୱ-Shwasa can occur because of two things. One is �શ્ಲೇಷ್ಮಾವೃತ-ಮುಖಶ್ರೋತೋ. That is, there is mukha-shrota of the shrotas mukha is get obstructed by the ಶ್ಲೇಷ್ಮ, by the different causes. ಶ್ಲೇಷ್ಮ is increased and that ಶ್ಲೇಷ್ಮ is obstructing the mukha of the shrotas, ಶ್ಲೇಷ್ಮ of the mukha-shrota. And as a result, there is a problem for the entry of the air and that is causing the problem. ಶ್ಲೇಷ್ಮ-ಆವೃತ-ಮುಖಶ್ರೋತ. Okay. So, Charaka further says that ಶ್ಲೇಷ್ಮ-ಆವೃತ-ಮುಖಶ್ರೋತ condition is again divided into two types. One is kapha-prabala condition and another one is vata-prabala condition. Okay. So, he says that in the treatment, kapha-prabala patient or sabala patient is also called as sabala patient. Another one is vata-prabala patient or durbala patient. That is, ಶ್ಲೇಷ್ಮ-ಆವೃತ-ಮುಖಶ್ರೋತ can be occur in two aspects, two levels. One is it may be because of kapha-prabala, another one is because of vata-prabala. So, we will take kapha-prabala patients as inflammatory edemas, fluid pathologies or sputum production causing the obstruction, and vata-prabala durbala patient, so that is partial or minimum or severe type of bronchospasm causing the problem. So, I think you got the point. Now, totally all the asthmatic children, broadly we will divide them as obstructive and restrictive. In the obstructive, it is ಶ್ಲೇಷ್ಮ-ಆವೃತ-ಮುಖಶ್ರೋತಾನಿ, and this is again two types. One is kaphaja, another is vataja. Kaphaja is a fluid pathology which is obstructing, and vataja is a bronchospasm which is causing the obstruction. Okay. Similarly, one more he says, 𝑢rಧ್ୱ-Shwasa, that is restrictive type of disorders. In the next line, he Charaka says, what is that? ಶ್ವಾಸಸ್ಯ ಬಹಿರ್-ಆಗಮನಂ ದೀರ್ಘಕಾಲಂ ಕರೋತಿ ನ ಚ ಪ್ರತ್ಯಾಹಾರಃ ಅಧಃ. That means there is no problem for the inspiration. Another set of asthmatic children, there is no problem for the inspiration. Inspiration is quite okay, but the problem is there for expiration. Patient is not able to expire the air out. This is basically occurring because of the problem with the lung compliance. Distensibility and extendability of the lung is get affected, or lung compliance is affected. Elastic recoiling nature of the lung is affected, and therefore the expiration, which is a passive process by elastic recoil, is not able in a normal way. Therefore, patient will have more problem on expiration. That is explained by Charaka. That is, ಶ್ವಾಸಸ್ಯ ಬಹಿರ್-ಆಗಮನಂ ದೀರ್ಘಕಾಲಂ ಕರೋತಿ. Prolonged expiration will be there. So, this is a second set of disorders of asthma which we can include under restrictive. There is a restriction. Okay, restriction for the expiration. So, therefore, restrictive type of disorders are considered. Okay. So, like this, all the asthmatic patients we will basically divide into two types: obstructive and restrictive. Obstructive or ಶ್ಲೇಷ್ಮ-ಆವೃತ-ಮುಖಶ್ರೋತ, and again it is of two types: vataja and kaphaja, and restrictive are another set of symptoms. So, now we have got two approaches ahead. Okay. For the treatment purpose, we have to further divide it into, as I told, vata dominant condition, another one is kapha dominant condition. Okay. Vata dominant condition is obstruction due to spasm, and kapha dominant condition is obstruction due to sputum, structural problems, fluid pathologies, etc. Now, let us see treatment of obstructive lung disorders, where kapha prabala patient, that is sabala patient is sabala, having samarthya, he is having capacity to tolerate. So, sabala patient, he has got some strength. So, what is the important treatment principles when you are dealing? Because all the asthmatic patient children are grouped under one heading and we are dividing it, otherwise the treatment is not possible. So, now let us see the treatment of obstructive lung disorders where kapha prabala condition is there, that is fluid pathologies or sputum pathologies or structural pathologies is there. What is the treatment now? First is Snehana should be employed, followed by Swedana. So Snehana should be given internally and externally, preferably with Lavana Taila, which does the vilayana of Kapha. Okay? Because Kapha itself is the main problem here and it clears the Shrotas. So Bahya Swedana over the chest area from all the sides and neck area with the Brihat Saindhavadi Taila is quite beneficial. You can use any other Lavana Tailas. Brihat Saindhavadi Taila is preferred. This will be followed by Swedana by using Nadi, Pata or Sankara, whatever advisable, that type of Swedana should be given because our aim is to clear the Kapha. So now Snehana and Swedana will be followed by Vamana, which is Kaphahara. Again, we have to remove the Kapha, therefore it is Kaphahara. Children with the chronic disorders, Vamana administration may be sometime very difficult. So hence a Sadhya Vamana after giving full stomach of salt water is beneficial. This is what we follow. Inability to conduct the Sadhya Vamana may be replaced by a Vamanopaga drug like Vacha Chuna administration, etc. Okay, that is also beneficial. This is now further, this will be followed by Dhumapana. So Dhumapana by certain drugs with Ushna and Kavahara property should be better administered, and the same can be also given for steam inhalation, which act as a Dhupana or Dhumapana. This helps to remove the Kapha which is adhering to the Shrotas and clears the Shrotas. Haridradi Dhupa, then the Tura Dhupa, Nilagiri oil, steam inhalation can be also used as alternative methods of steam inhalation. Raka also explains administration of certain Kapha-hara drugs for a long period for removing the collection of the Kapha which is adhere inside the Shrotas. For example, Pippali, Maricha, Ela, Ativisha, these drugs can be given. These drugs can be given to remove that extra amount of Kapha which is adhering there. So like this, we are achieving the Kapha-hara treatment here, employ all these measures because given in Sabala patient. Okay, this is given in Sabala patient. Next we'll look into the treatment of obstructive lung disorders where patient is Vata Prabala or Durbala. Patient is Durbala, Vata Prabala, and what is the cause? Cause is spasm of the bronchial muscles. Cause is spasm of the bronchial muscle. Not the Kapha is not Kapha or fluid pathology is the cause. Here plain there is absolutely